Hello, everyone, and welcome back. My name is Lauren, for those of you who do not know me, and I am the host of Speak Up Law. So to continue on my great conversations about Clark Atlanta University, I called in my friend Patience for us to have an amazing conversation that really hits home for me personally as well. So Patience, welcome.
Thank you so much for having me here.
Yeah, so we're gonna have some fun. We have our coffee with our special mugs, and Patience and I have actually done this before with a great coffee and combo. And for the record, we did not plan this matchup of outfit, but that is just how synced we are. So excellence all around.
Right.
So introduce yourself. Tell us about you.
Well, my name is Patience Riley. I am a mental health therapist. I am also a mental wellness coach. So I have about 10 years of experience as a therapist, work with a lot of different populations, and my big focus right now is perinatal mental health. So I run a private practice, but have worked anywhere from juvenile detention center, a psychiatric hospital. When you and I met, I was working on base, military installation, but worked with community mental health as well. And then just kind of did my private practice at the same time. And that's just been my main focus now because I move around quite a bit. So, that's just been the easiest way for me to kind of maintain with that. So maternal mental health is the big focus of the practice now, even though I do work with other folks.
So to make sure that those at home know what that means, what is maternal mental health? Is that correct?
Maternal mental health. So anything with like expecting mothers and motherhood. Okay. So with perinatal mental health, that a lot of times is anything from pregnancy kind of afterwards. So I like to go through expectancy and the whole entire motherhood journey as it relates to mom's mental health. So
Okay, that's very interesting. And you had an amazing journey, I would say, in the mental health therapy world. How did you decide to get into that space?
I actually wanted to do research first.
Oh, okay.
So I was an undergrad, decided that I wanted to do research and just do behavioral sciences. So got a psychology degree and then came around like junior, senior year. I was like, I don't think I just want to strictly do research. I want to work with people specifically. So then I decided when I was applying to my master's programs, I was going to apply to counseling programs first. Okay. And see how like working with people one-on-one in groups, how all of that was. And then if I later wanted to go back and get a PhD and transition to the research side, then I would. I've stayed with the therapy side.
Okay. Wow. So therapy, of course, in the Black community can be a little cliche. It is something that I don't really quite understand it from my point of view. I am very fortunate. I would say me personally, I got into therapy officially last year. This is 2021. Last year, and I am so thankful that actually within my family it was supported. And I know that is not normal. And so just understanding, maybe to hear from your perspective, why is it this way, and how can we start changing that narrative, because it's so beneficial.
That's huge. I actually just started working with someone where the whole reason that they came to me was, hey, I'm trying to take care of myself as a person, and my mental health is a part of that. And actually was speaking to their family members of, I really think that this is something that we should dive into. We're a Black family. I know that this isn't something that we usually talked about or touched on, but she's trying to change that narrative in her family. So I think that that's a great example, is to actually take the step and start doing it. Because she just told me, she was like, Patience, praying about it isn't enough. I know we've talked before that I can have Jesus and therapy.
Hello, amen, hallelujah.
And so she was just saying like the same thing of, praying about it just isn't enough. Sweeping it under the rug isn't enough. Not talking about it isn't enough. And I know a lot of times, sometimes we have to have like, I need to be strong. I have other things that are going on because we're battling other struggles as people.
Yeah.
And so we have to almost put our health to the side and put our mental health just kind of on the back burner because nobody can see it.
Wow.
And it's just like, let me pray about it. Let me just kind of grit my teeth and just go through this because I have other things that I have to worry about, and I don't have time to kind of worry about that. And also I don't want people in my business.
Yeah.
That seems to be a huge one too. Like nobody can know our family business or know that these things are happening. And so let's just act like it's not going on.
Wow.
But that's one of the things that I'm like loving about our generation. And my mom will tell me all the time, she's like, I love how you guys are trying to take care of yourself. And so she mentions that a lot with our mental health.
That's big.
Just because she was saying like, you know, I'm used to that being something that was swept under the rug. Like that is something that I think a lot of a lot of our families are probably guilty of doing, but it's almost our jobs to then change the narrative. So
I agree with that.
I think it happens just with that could be that one catalyst. So how you said, hey, I mentioned this and my family was very supportive.
Yeah.
And then, like I said, I'm working with that, you know, working with the specific client, and she said, I told my family, I was very open. At first, you know, they kind of listen, and it seems like they're coming around to it. But she's sticking strong to, you know, this is something I'm gonna do. This is my profession, of course. So that has now entered into my realm, into my space. So if we want to change the narrative, we actually have to step up and do it, and also talk to people about us
what
doing it and being vocal.
Yeah, I agree with that because before getting into therapy myself, I was always an advocate. Like, of course, yes, get in therapy. It's amazing. But I never had even addressed any of my issues for all of my life. And I was like, oh, this is much different. But there is, I would say you have to have the right therapist too, to be comfortable, to get into that process of sharing, I would say the family business or just sharing anything under the sun. That is not just it's not easy to do, I would say right off the bat. So I was like, I don't know, but it has become the best thing for my life. So now, like before I was, you know, pro, but really like I feel like I wear it on my sleeve, a big shirt, like please get in therapy because you don't know how beneficial it is.
Yeah, definitely. And I think you bring up like a great point of the fit of the client therapist. Of not everybody is everybody's person. And so I'm not everybody's person, and that's okay. Like I'm perfectly fine with that, and I'm comfortable with that now. Maybe not so much new in the field, you know, because you're still kind of finding your way. You're kind of navigating, and sometimes you have those insecurities too when you're new to a profession and you're like, everything's supposed to work out great. I'm supposed to be able to help every single client. There should be able to be progress. But then you kind of realize like, this is my style. This is the population that I work with. These are the kind of clients that kind of gravitate towards me, that I enjoy working with. And typically, you know when it's a fit. So I always tell my clients now, session one. Like, because just from hearing along the way, if I say, hey, have you ever seen a therapist before? One common theme that I noticed was, yeah, I saw this person for a few times. They were a really, really nice person, but it just wasn't that helpful. And so they just kind of stopped going and maybe took a little while to kind of get back in. Or there were some where it was like, that was just horrible. It was the most awful experience that I've ever had. I felt unseen. I felt unheard. So you may not find your person the first time, but I don't want people to be discouraged of finding their actual person, because it could take a couple of interviews. I mean, people date. And so
I was thinking hairdresser. I was thinking like, okay, I got it. You know, takes you a while to find that person who matches your hair, your makeup, everything. Like, it's not just right away.
Yeah. And so because I've heard those stories, I make sure that I always just say, hey, I am supposed to be here to help you. You are not coming here to get a friend. You are not coming here just for something to do. And you're really not coming here to waste your time or to waste your money. So time, resources, and money is huge. And I'm just like, if you are not finding this relationship beneficial, I don't care if you think that I'm a nice lady. Please do not continue to come to me just because you think I'm a nice lady. I would prefer that you either tell me like, hey, Patience, I'm not finding X, Y, and Z helpful. Or when we have done this together, I have found these things to be really helpful. Or, hey, you know, I think maybe let's meet one more time, but I might have to explore some different avenues. And I know that can be a very uncomfortable conversation to have, because you don't want to hurt somebody's feelings. So,
because you can be delicate in that period or point
you
in life.
really can. So I like to break the ice and say that first session and just tell them, please tell me. You will not hurt my feelings. And 9 times out of 10, if we're meeting and you feel like something's off, I probably feel like something is off too.
Okay, yeah. So it's better just to put it out in the open. But so from a representation matters. So for me, I definitely love personally that my therapist is a Black woman, because I just feel that inherently she gets my struggle just by the nature of it. I've heard kind of back and forth of, you know, if you should, I've had some interesting conversations of if you should or should not have a therapist that looks like you. But for me, there's just so much comfort in that relatability. How is the industry as a whole for, I would say, representation? I would say of more of the Black, brown community versus non.
Well, traditionally, when you think about like the counseling field and the psychological field, everybody who we learn about are all old white men.
Wow.
Like, so
from school and stuff.
Yeah, from school.
Wow. Okay.
So when you hear about like, this is your theoretical orientation, or if you hear your therapist say like, this is the kind of approach that I take with working with clients. So I do like cognitive behavioral therapy or solution focus or, you know, psychoanalytic. All of those theories, of course, were developed way back when. You know, by people who do not look like us.
Yeah.
And so in my circle of people that I do know as therapists, of course, I have surrounded myself around therapists that actually look like me as well. So I do have a lot of colleagues, but I still feel like it's up and coming. And sometimes people don't really realize that there are young, brown, Black therapists out there, or they're searching for them. And one of the things that, even taking it back to even when you're in school, when you take your classes and you're learning, and some of us, I think, already just kind of know this because of coming from the background, you're gonna learn from research that Black and brown people typically prefer a therapist that looks like them.
Okay, yeah. I mean, that's with anything. I've personally have just gotten my first Black doctors, dentists, dermatologists, and it's just, I've had the horror stories of a dermatologist that wouldn't even touch me. And that to me was very jarring and an experience that it was like 2018, 2019 when that happened. So very recent. And so to have that comfort, especially in something so important with mental health, was something that I personally felt like I needed to get the help that I felt best.
Yeah, I think it's almost that trust level sometimes. I had a client who, she was referred to me just through her insurance company. So when she actually came and saw me in office the first time, she like did this huge sigh and she was like, you are brown. She was like, I don't want to offend you. I'm not sure what your race is. So like she did say that, but she sighed and she was just like, I don't know if this is appropriate or not, but can I just give you a hug?
Wow.
And she was just so relieved. And it was because she was in a very similar profession to mine. And it was toxic. And it was a very toxic environment with higher ups of people who did not look like her.
Wow.
And so it was just very comforting for her to realize, like, I've been paired with someone that looked like me, because she wasn't sure, because she was referred by the insurance company. We had only had a conversation over the phone, and she wasn't sure with what my name was. So she was just like, this is my first time doing this. I've never done this before, and it broke the ice.
Yeah.
Essentially. So I have noticed that with the Black and brown clients that I have worked with, that sometimes it seems like it's a sigh of relief, almost. And like you said, I feel like you kind of understand, and maybe you get some things that I don't have to explain. Like
off jump.
I don't have, I don't have to explain what this means. You already know what I'm talking about.
I had my therapist in one session. She was like, "Oh, girl, that's a lot." That phrase, I was like, "Oh, she gets it." Because yes, it was a lot, but I needed that relatability for me, because that doesn't happen. Like not saying that wouldn't happen with someone who didn't look like me, but I just knew how I was saying that phrase. She knew exactly what I was going through.
And then kind of on the other end of things is, just because somebody looks like you doesn't mean that they're going to be your person. Like that, I think, is also important for people to keep in mind. So our expectation level is that therapists are still people, and people are still flawed, and sometimes people don't, they just might not be your person. So it may not be a good mesh. So to maybe not have your expectation just as an unrealistic expectation of like, yes, I'm about to go see this Black woman, and because she's a Black woman, everything's about to be amazing.
It's like, I'm going to get fixed right away. Yeah, because it's not a one session type of thing. And I think with a lot of times when you start in therapy, or I say baby into this because I'm just starting my process, and I felt like initially I was like, okay, yep, I just need to go 1, 2, 3 times, help me work through this situation, and I'm done, and I'm back to being, as I say, the perfect Lauren, and I'm fix me really quick and go back. And I've learned that, I got a lot to work on, but it's fine. Like, it's not bad. So I was like, so to kind of shift gears to talk more in particular with your business, and I love that you're in this space because just the stats and things that I see, especially tied to Black women, and having someone that can really help you through the stages of pregnancy and childbirth. Like, I feel like that's an amazing field to be in, because I don't think I don't know much about your field from just like research of not being in the space, but it's great that there is representation, especially someone who's younger, because I feel like it's just a relatable point. So can you talk more about your business and really kind of sharing about that?
Yeah, so with my private practice, like I told you, I ended up transitioning fully with that, partially just with the times and being a military spouse. So bouncing around, moving all over the place. And everybody is very open to virtual at this point. So with being open to virtual, it's allowed me to still be able to see clients, to do workshops, to do support groups and things of that nature. So I did end up getting specialized training in perinatal mood and anxiety disorders, just to kind of add that on with working, like, this is what I kind of want my focus to be. But how you were saying some of the numbers, like, it is pretty alarming, some of the numbers that are out there. So one of the big things that I've been seeing a lot, and I'm, I think for some of us who are either trying to have babies or currently having them, is that maternal mortality rate.
Really?
And
Wow.
it's highest amongst Black women.
Oh.
You know, just maternal mortality rate in general is just highest amongst Black women, and it's really, really high in the US. So that's a huge thing. Also, just when it comes to, you know, the postpartum depression, the postpartum anxiety, I won't go through the full list of all the diagnoses, but all of those things, it's higher in Black women. So it's 2 times higher in Black women than it is for their white counterparts, but Black women are less likely to get treatment. So that itself is huge.
Wow.
So that's where I feel like also representation matters, because when you kind of start connecting the dots of, okay, well, Black and brown people, it's showing us that sometimes they're more likely to see somebody who looks like them. But then, you know, we have all of these other things going on, you know, getting access to resources, just the stigma of it actually being something, the stigma with it related to motherhood too, is a huge thing. But it's just, for me, I'm like, my representation, I feel like, really matters, because I'm like, Black women are dying at a higher rate. And they're also not getting the mental health treatment that they need and that they should have and that they deserve to get. You know, whatever the reason or the circumstances is. So if I can kind of direct my energy into that part of my field and try to fuel and figure out ways that I can best assist my other Black women out here, that's what I'm gonna do. And that's what I'm gonna have my focus be, just because mental health after them, during and after those kids, it's a thing. So, and it's something that needs to be talked about. And moms, not just Black mothers, all mothers, but you just have a lot of things that get added on. And I think we expect our moms to just not be flawed at all. So that's part of like why I'm like, I need to really focus. This is my focus, like right now, is trying to serve this population.
And that's big. I was like, I hope this is right. I believe my mom told me one time, she was like, being a mother, you get no playbook. So you're literally learning like on the fly. And I can only imagine the stress, because I'm not a mom, so I can only imagine like the stress and the pressure, and you have a human being, you know, that you're now taking care of. And just and before you even give birth, and just all the stats, because that's something that's honestly scared me. Even now, I was like, I don't say that I don't know if I want to have children, but it's just really like the fear starts to come in because you know the stats, you know the numbers. So it's just been a very interesting journey for me of knowing that information.
Yeah, I was chatting with a friend recently, and she and I were having like a similar conversation. And sometimes we were like, gosh, I feel like I know too much. Like, like, God, I know all of this information. And she was sharing something very similar to that of like, it kind of makes me nervous to even attempt to pursue that because I have this knowledge and knowing that. And so that's where there is a bit of a balancing act of like, just because you do know this information doesn't mean that it's necessarily going to happen. But also, knowing this information can help and better equip you going forward. And so prevention is huge for me. Like, and I think a lot of this goes back to, I did a lot of crisis work.
Oh, yeah.
When I first started out. So everything was full blown out crisis. It was at its worst state that it possibly could be at. And so as I've just gone through the profession, I'm like, where's the prevention? What can we do to assist with prevention? And some of that prevention is education.
Gotcha.
It's letting people know that this is actually something it's okay to talk about.
Yes.
It's okay to figure out ways to deal with it, to cope with it. And if you do end up having something that is going on and you need to get that professional help, then it's okay for you to actually get it. And these are some ways that we can help you get that help.
And that's a big reason why I wanted you, especially in this segment, because I really want people to know, like, this is very okay to talk about. This is not like, it doesn't change who you are as a person. Like, just talk about it, because when you start letting it out and letting it go, that's where you can really like, I feel like I've learned more of myself, and I feel like people can learn more about who they really are when they let down some of these things that we hold in forever, and that's not healthy. I was like, I don't know. That's where I'm at.
Yeah, and it is, and it's having somebody who is going to be that unbiased person, because it's different than just having like a friend or a family member that you just go to and you talk to.
Because they'll have their biases in there. Yeah.
And they may not mean to. Like, that's the thing. They might not mean to have their biases, and not saying that a professional might not come with their own biases as well. But we're trained to
Is to not? I'm assuming?
to not,
Okay.
you know, or to not let that affect us, or if it does, to make sure that you get your client to someone if you feel like you can no longer be effective with them. But that's the thing. Sometimes it could be easier to share the information with somebody who knows absolutely nothing about you.
Yes. Yeah,
You know,
that does help.
Because you know how things kind of can go like both way. Like, oh gosh, I don't know if I want this new person who knows nothing about me to know all of these deep, dark secrets and, you know, all of that. Or it could go the opposite way of, it's like, well, they don't know me. I don't feel like they're going to judge me.
Yeah.
They're not going to have, they don't have expectations of me. Let me share that information with them, because
it just works out. Yeah, my therapist told me, she's like, wow, you share a lot. And I was like, at this point, I don't have any, like, I didn't have any energy to not share anymore, because I was at the space, I just held everything in and I talked to a friend here, a parent here, but never really like pour all of it out. So now I was like, oh, I'm so, I don't say, not to say messed up, because I don't know if that's like, I don't know best terminology, because I don't want anybody to feel that they're messed up. Like, it's just, this is how you are going through life, and you just need a better, I would say, guide to help you. Because it's something that I love that you said in one of our many conversations. Patience, I talk a lot.
I'm like,
but it was about having your doctor, having, you know, your dentist, and having that, you know, annual checkup, biannual checkup. Like, it's not something that you can't just get fixed in, you know, a day. Like, and making sure you have that checkup is very important.
And it's not something that you may have to have all the time. Like, but it is that, like, your mental health is still health. And so when it comes to just taking care of our health as a whole, I mean, if you have a hard time going to the doctor, it may be a little bit harder for you to go to a therapist or like a physical trainer, or to go to the, like, that just health as a whole may just be the goal. Like, how can I work on my health better, but not excluding mental health?
Yeah, it's part of it.
And that's one of the things that I'm just loving about now, is I'm seeing that a little bit more. Whereas I feel like 10 years ago,
yeah, no way.
We weren't,
like, couldn't even talk. I would say you couldn't talk about it. Like, my friends now openly like, oh, so when's therapy? Oh, you have therapy tomorrow? Oh, okay. All right. Yeah, no, mine's Thursday. Oh, okay. Tell us how it went, you know, after. It's just a quick discussion point, and it means nothing.
Yes. Whereas before, it was like, if you were going, it was like a top secret. Nobody knew about it.
Park around back or something.
Yeah. Like, how can I make this as, like, of course it's going to be confidential, but how can I make sure that nobody knows that this is something going on? But it's like, if you're going to say that you're prioritizing your health as a whole, your mental health should be a part of that as well. So mental health maintenance, so that we're not having those crisis situations.
Yeah.
And that's the thing. You can see a therapist, you can talk to someone when honestly you're like, hey, I want to prioritize my health, or I'm having all of these life changes. That's one of the things. We're going to have life changes.
Yeah, all the time.
We've had tons of them. Like, when you think, like, just from going from being a kid to a teenager to an adult, those are all changes. Going from working different jobs, that's changes.
Yeah,
Moving to a new place, that's changes. Getting in and out of relationships, that's changes. Having a baby, that's changes. Like, so it's just, we have all of these different life changes. And sometimes it's like, hey, it's okay for me to see somebody for that particular time period. And maybe I can just keep them on retainer and give them a call. Because that happens too. Like I've been contacted by folks who's like, hey, they've seen me for a few months, and they're like, you know what, I think I'm doing better.
Okay.
You know, I think I'm doing pretty well right now. And then so we maybe set up one more time to meet. And I just always let them know if anything happens, anything changes, just send me an email, give me a call, and we can just always do a check-in. And that does happen from time to time, where it's just like, hey, can I just
like, I need to back away for a
come
second.
back in? Or if you're just saying, hey, I just want to maybe pop in once a month.
Oh, yeah.
And do just kind of that maintenance as well. It doesn't have to be like, oh my gosh, this huge thing is happening. It's a catastrophe.
Yeah. It's just a maintenance. Just like a hair appointment. That's like, keep yourself together.
And that's the thing. So it's like, it's just health. A very, very important part of health.
Say that again.
It's just health. Like, so that's why I'm like, not to like downplay it, but if we just almost normalize it, like you're gonna go and check your blood, get your blood pressure checked. You're gonna check and see how much your weight is. So you might need to check on how your mind is going and your thoughts and your feelings too. That's just my equivalent. So
So this, of course, is an amazing conversation and understanding and really diving into mental health. But of course, you know, we have to give those resources, how people find a therapist, because that is important.
and so there can be several ways depending. So one go-to, if you have insurance, that could be one thing. Contact your insurance company. Make sure that you have mental health coverage. And that's if you want to use your insurance. But that could either just be a phone call out to your insurance company and ask them for a list of therapists. And then you'll then make those phone calls, or if you have like the online access.
Okay.
So I know I do everything online. So like when I'm searching for doctors, therapists, dentists, all of that, I just do it online. Look them up. I like to look people up and then start making those calls after that. So that can be a first one. Regardless if you do have insurance or not, because some people don't want to use their insurance, or say they're looking at a directory site. So there's different directories like Therapy for Black Girls.
Oh, wow.
There's Black Female Therapist is a directory. There's Therapy for Black Men that are out there. There's also some Latinx therapy directories. Honestly, if you kind of type in any of that, you can get a directory. But some that have lower cost therapy options, Dark Health Beauty or Dark Beauty Health, they have different therapists that have given 10 hours of therapy sessions.
Really?
So essentially it's going on the site and looking for your state. So for us, we would look up Georgia, we would see who comes up, and we would see if they have availability or if they've been full. So, and you could contact them specifically from that site, and that's therapists who have donated time, or there is also Open Path Collective. And with Open Path Collective, their therapists are doing like a sliding scale, reduced rate. And they do it for individual therapy as well as couples therapy. So if anybody's needing that couples therapy, you can go on there as well. And then also there's the Loveland Foundation, and that's specifically for Black women and Black girls. And you can be somebody who is currently in therapy. So for instance, you're in therapy right now, you're a Black woman. So if you went on their website and you like apply, you don't have to be new to therapy. Their funds specifically go to therapy for Black women and Black girls. So amazing. For instance, I know someone who received funds, and I believe they received 3 or 4 free sessions. So
and that can be a game changer, just to have something. I'd rather somebody get something than like absolutely nothing. Still dealing in everything.
And when I was like, listening, they're like, hey, you know what? Even if she's already going to therapy, that's 3 or 4 sessions that she doesn't have to pay for now. And
let me go on that
side
really quick.
But it is something that you're eligible for.
Okay.
That's for people who are even in therapy. You don't have to be brand new to therapy to get connected to that. You also have other directories out there like Therapy Did, and then like a huge one is Psychology Today. But if you're trying to get like kind of specific, like we were saying, if you're wanting to find somebody who looks like you, looking at some of those more specific sites. So
then in picking that therapist, how does that, by the grace of God, I say mine just worked out. But how do you know, and you're looking at the directory, who to pick and who to even start with?
Yeah, so like I told you, I like to do research on people and resources and everything anyway. So what you're trying to figure out is, hey, is this even going to be a good fit for me? So one, you can actually, I like directories because you can see people's faces. Or if you are getting it from your insurance company, seeing if they at least have a website, or if you type in their information, does a directory pop up? Because then you can visually see the person. You can typically read about them and how they work with their clients. There'll usually be like a blurb. And so a lot of times, if you are a very action-oriented person, you're probably going to want a therapist that talks about that type of language of setting goals, having an action-oriented plan. Maybe there's somebody who works with like a CBT, a cognitive behavioral therapy background, or more of like a solution focus. It's somebody that works with those therapeutic styles that's going to move you towards action, or they're using that type of language and seeing if that fits with your person. So, hey, let me check out that blurb and see if there's even a good fit. Also, seeing if the person offers a free consultation. So that's one of the things that I offer is a free consultation, just because it gives us a chance to actually speak. Like you can hear my voice, they can hear my voice. It's a little bit better than just an email, because an email, hey, can I set up an appointment, blah, blah, blah. I still like to do the consultation so that you can tell me not everything, but hey, what are you interested in coming in about? And I can even let you know if that's something that I'm able to assist you with. And you can also ask them, this is what I'm coming in. I've had people say, this is what I'm experiencing. This is what I'm dealing with. Is this something that you think that you can handle and that you can go with? And it also lets you see, like, am I kind of getting a vibe from this person? Is it a good one? Is it one that I'm not so comfortable with? How is their etiquette and professionalism over the phone or video, if that's how they do it? So consultations can be huge because it's almost giving you a sneak peek and just asking them different questions like, can you assist me with this problem?
And that's a big, because from an expectation, you don't want to just show up and then you're like, well, they didn't help me. Like, but if you didn't have that pre-call, that may not be their specialty.
Exactly. And if you're kind of questioning whether or not it's their specialty from just reading their information, it could be worth having that conversation and that call just to kind of double check with them. You can also ask them, how do they typically work with their clients? Like, what kind of approach do they typically take with them? Ask all of your financial questions as well. That's a time that you can do that so that you have that expectation. How often would you be able to meet with me and checking in with that. But it doesn't necessarily mean that, hey, you may have the consultation. It may seem okay or go great, and you may be a couple of sessions in and still feel like something is off. A lot of times around session 3, I think, and
that's a good point.
You can kind of tell me from your own experience on your side of how you felt. But I feel like around session 3, you probably have an idea, at least if it's a good connection, or if it's somebody that you want to continue to work with.
I like that. Yeah, that's a good. I was thinking, if you could see my brain was thinking, I was trying to think like, wait, session 3, yeah. So session 1, I was like, man, like I'm kind of learning you, but not really. But session 3, I was like, oh, I have, because I'm an action person. So I was like, well, I have my to-do list, and I have a plan. And for me, it was very important to know, like, okay, you're moving towards feeling better and getting better. And that's what I need to just see pretty quickly. And but we had really good discussions in my sessions, like, what do you need? How do I assist you to be the best therapist for what you're going through? Because that, I would rather have that conversation than to get to session 6 and I've been spending all this time and money and nothing's changed.
And that brings me to, do you find your person helpful as well? Because if you've been meeting a few times but you haven't really found it to be a helpful experience, like I said, regardless of how nice the person could be, if you just feel like there isn't anything that's really helping you, a conversation could be had with them if you would like to, of like, hey, would you be able to do some more action-oriented type things? Or would we be able to dive a little bit back into these past experiences that kind of keep coming forward and stopping me and blocking me from moving forward? If you feel comfortable having the conversation with the person as well. But session 3, I think, is kind of a good space. It's a good space to kind of be like, do I want to continue with this person, or do I maybe want to seek somebody else? And it's okay for you also, when you're looking through the directories, or even setting up consultations, to set up more than one consultation.
You gotta see, like,
at a time.
Right,
Yeah, you don't have to just set up one, see that person, and then start over.
And that's who it is.
Yeah, you can set up 3 or 4 consultations if you want to, and then take your pick.
That's a really good point. My friend, when I finally got into therapy, my friend actually had to send me a list because I was just so outdone. But I think it was about 8. And but what I loved about that was being able to have a list of options. If this doesn't work out, I know I have 7 others. So I'm gonna get help somehow by somebody on this list. But yeah, it's good to not just one and done.
Exactly. So maybe even when if you do go on that directory, it could be nice to have like 3 people. You know, like you said, like these are like my 3 little circles of this, of the people that I could try, because you also never know if somebody's going to be full. You never know, like, say you do, I respect people's decision of like, if they have to use their insurance and stuff like that, and maybe they can't go with me, then that's something, hey, give me a call if anything else changes. You know, sometimes that happens, sometimes it doesn't. But they may, if they only had their eyes set on me, and for some reason that ended up being the only barrier, it's nice if they have a backup. So they're not starting from scratch, and it's just like, oh gosh, now I gotta go do this again.
And I didn't get the help I needed.
So start yourself out with a couple of options. And one of the things is if people are open to telehealth, that can kind of expand for you, as long as you find somebody that's in your state. Because the person just has to be licensed in the state that you're in. You don't necessarily have to restrict yourself to the city.
Oh, okay. That's nice. Okay. That's
So, for instance, where I'm living now in Georgia, I did not really find very many Black or brown therapists in the area. Atlanta was the closest. I'm obviously not going to drive an hour and a half to 2 hours to get to Atlanta to go to a therapy session, but because telehealth is there and it's available, it opens that network up, which I also think is really, really important. It's going to allow people to see a provider that maybe they couldn't have seen before.
Because of the state. Wow.
That would be great too. So also just being open to telehealth. It's for some people and it isn't for others.
I do telehealth, so I'm fine with it.
It's open. It's good for you. You're open to it.
So in a big, are those the main tips? I don't want to make sure.
I
just want to check.
I think I covered enough. I felt like I was rambling on a lot.
You're fine.
Was that good, Erica?
Oh, yes. So one of the big things that I did ask patients was to do an activity as another resource for us. So we're about to get changed up and we'll be right back.
All right, well, like Lauren said, we are going to get into an exercise. A progressive muscle relaxation is an exercise that I like to do with clients who are experiencing a lot of anxiety, a lot of stress, who are experiencing a lot of tension in their body. So what it does is it allows for you to tense different groups and parts of your body and then relax them. So when you are relaxing the body, it is showing the difference of this is how it feels to be tight, which sometimes we do unintentionally, and this is how it feels for my body to feel loose. So by purposely and intentionally putting your body through this exercise, you're trying to teach your body how to become relaxed.
I need that.
Yes, so I do this often because I am a person who tenses my body. So I tense my shoulders, I tense my jaw a lot. So we're gonna focus in those areas as well. So if you just wanna go on ahead and take a couple of deep breaths for me, just in through your nose and just out through your nose. Just a couple of just intentional deep breaths for me. Alrighty, and if you want to, your eyes can remain closed the entire time. They can just kind of gaze down. It's whatever your comfort level is. So just continue to take some deep breaths for me. And just feel your body becoming more relaxed. All right, now deep breath in through the nose. Exhale out through the mouth. Again, in through the nose, out through the mouth. So Lauren, as we're going through the exercise, when you inhale, I'm gonna ask you to tense. And then as you exhale, I'm gonna ask you to release. So there will be some pauses in there, but I'll instruct you through the pauses the whole time. Okay, so we are going to start with your toes and then we're gonna move up your body. So go on ahead and just have your breathing be normal. Every time that we do an inhale, I'm going to ask you to tense a certain part of your body, hold for a little bit, and then on the exhale, you're gonna release and let that go limp. So try not to strain yourself when you're tensing. If at any time during the activity you feel like you've strained too much, it's okay for you just to breathe through that part. You don't have to actually tense yourself at that particular time. All right, so let's do one deep breath in. Let's hold that, and then let's exhale out. All right, so on the next breath in, let's curl your toes under, and you're tightening those. You're holding, and then you're going to exhale and let them go completely limp. Let's do that one more time. Inhale and curl. Hold that. Let go loose and limp. Alrighty, so next we're gonna move on up to your thighs. And you can still just breathe normally in between. With your thighs, I'm gonna have you tighten your thigh muscles on the inhale, hold that, and then release it and let it go limp. Same like how we did the toes. So go on ahead and take a deep breath in for me and tighten your thighs as tight as possible without straining. Hold it, let go loose. Just completely loose and limp. And if you need to be a little dramatic, that just gives you more of an effect. All right, so go on ahead and breathe in for me. Tighten those thighs, hold it, and let it go limp. Perfect, perfect. So now we're just gonna focus on from your waist to your feet. So the whole lower half of your body. So tightening of those thigh muscles, even your calves, as well as curling your toes under. I want you to go on ahead and take a deep breath in and tighten everything from the waist down. Hold it for me. Dramatic let go. Perfect, perfect. We're gonna do it one more time. Inhale and tighten everything from the waist down. Dramatic let go. Perfect. Stomach is our next area. We're moving on up. So with stomach, when you breathe in, tighten your stomach muscle and try to have your belly button touch your spine. That's essentially what you're trying to do. So yeah, so go on ahead and take a deep breath in for me and try to have that belly button touch that spine. Hold and exhale. All right, beautiful. Breathe in again for me. Belly button touch the spine and hold and exhale. And we're even gonna work your back. So that's the next spot. So with the back, what I'm gonna ask you to do is, in order to tighten it, you're gonna kind of lift up and do an arch. So that'll automatically tighten your back muscles for you. And then when you let go, you'll lay your back flat on the ground again. Okay? So let's inhale in and arch that back up. Perfect. Hold it for me. And then let that go limp on the exhale. On your inhale, go on ahead and arch the back up. And then on the exhale, let it go back down to the floor. Perfect. Going up to our arms. So with our arm muscles, you're going to kind of focus on these upper arms. So I'm going to ask you just to bring your hands up to where your shoulders are and just tense that. So it'll just look just like that. So whether or not you want to have your hands like this, have your hands like that, it's completely up to you. All right, so on the inhale, go on ahead and bring it up for me and tighten your arms. And then exhale and let it go limp. On the inhale, go on ahead and tighten the arm muscles. And then exhale and let it go limp. So that may bring a little bit of a warmness to your arms from tightening it. And then we're moving up to our shoulders. With your shoulders, you're going to lift those up towards your ears and hold it and then drop them and let them go limp. So on the inhale, go on ahead and bring your shoulders up. Let it go limp. Inhale and bring it up. Exhale and limp. And we're finishing you off with the face. The face is very important just because sometimes we forget that we tighten our face. So I'm going to have you focus just on your jaw for today. With your jaw, just kind of tightening. You can keep your mouth closed, but tighten your jaw muscles on the inhale. And then dramatically drop and let go. So even if you need to open it a little bit so that your jaw drops down, you can do that as well. So on the inhale, tighten. Hold it for me. And then exhale and release. And then, yep, you're loosening it. Perfect. On the inhale, just tighten your jaw. Exhale, you release. So just take a few more deep breaths in for me. And go ahead and exhale. One more breath in. Exhale. And last deep breath in. And then exhale. Now you can just let your breathing go back to normal. Just the normal pace. Yep, you can bring your hands back up to a comfortable position. You can start opening your eyes if they were previously closed and just have them come back to a good gaze. And just kind of think about the space that you're in. With this space, it's important to remember that you can control what your body does. And sometimes our bodies make us feel like we don't have the control. But you can always come back to the space of, this is how it feels for me to be tight. This is how it feels for me to feel loose. This is how I can feel stillness, calmness, and peace are very important. You can always do it here. You can do it laying down, or you can do it even sitting up like how I'm doing. So if you feel comfortable, you can come to a seated position. I always like for you to kind of feel completely calibrated at first before trying to come up. So just wait until you feel comfortable to rise to whatever seated position it is that you were previously in. So how do you feel?
Good. I was like, it's a different experience that I've never done that exercise before.
Okay.
I've heard clenching, I would say any muscles, yeah, I was like, no, especially the jaw, because that's where I hold a lot of my attention. So I feel that I will do a lot of jaw and shoulders, because that's usually what I always hear is like, oh, you hold stress in your shoulders. So,
Yeah. And then so one of the quick ways, I did a little bit of a longer version with you than I typically do with clients in office. In office, I'll usually just have us focus on, let's just tense our entire lower body. And then I do it typically 3 times around. So hold for 5 seconds, release for 5 seconds, 3 times, lower, midsection, and then I usually try to do shoulders and face so that they don't forget about those particular pieces, because I feel like shoulders and face is where we hold a lot of tension, but we neglect a lot of tension, as well as our back too can be one of those. So I'll give out like an extended version that they can take home with them and actually do. And you can find progressive muscle relaxation scripts online all the time just by typing it in. And you can literally just do it at home. I prefer to do it how you did it, laying down, but sometimes people will do it in this kind of way. You can do it in a chair. I find a chair to be a little bit awkward, but unfortunately when you're in session, you end up having to show people in chair. So I just like to see how people's bodies feel afterwards. After you do it, sometimes you get a little bit comfortable, more comfortable. Some people love it and some people hate it.
Okay, interesting.
So it's one of those types of things. So if it's something that if your body's feeling tense, you have another tool that you can add to your toolbox. So
I love it.
Great.
Yeah, so one thing that I've asked everybody to end with in their sessions is, what would you give advice to your younger self or a young person?
With my younger self or a young person, try to learn about a variety of things. I'm just thinking about like exposure and more so specifically like within the field of work, being exposed to different populations, being exposed to different people and different networks as well, to figure out what you like and what you don't like. Because sometimes we don't know what we like or even love if we haven't been exposed to it yet. And sometimes we just know a lot of what we dislike. So trying to soak up as many experiences that we can have as a young person and not take those for granted by just being stuck in, hey, this is the path that this person told me I should go on, or this is the path that I thought that I should be a part of. Like, everybody doesn't have to do that traditional path. We can try all of these other and different things. So don't be afraid to explore and just try those things and see what works for you by just that exposure.
I love it. So. Yes. So young people, listen. explore different things. So that is all for today, and thank you so much, Patience.
Thank you so much for having me.
Until next